Andrew Krause, who's a student at the Brampton Civic Naturopathic Teaching Clinic, and just have a few questions for Andrew. Andrew, thank you for taking these questions.
Thank you for asking.
So first of all, just broadly, how have you found your experience here as a student at the Brampton Naturopathic Teaching Clinic?
So I'm here twice a week. I'm here with Dr. Malone on Tuesdays, and I'm here with Dr. Parikshah on Wednesdays. And I've really enjoyed my experience here at Brampton. It's been good because it's a different environment, a little bit different population than you see at the RSNC, and at the same time the physical setup of the Brampton clinic here is quite different from the physical setup at the RSNC too, in that I feel like it promotes collaboration between my colleagues and my supervisor here, as opposed to at the RSNC.
Great. In terms of the patients that you're seeing, can you give us sort of a broad snapshot of what sort of range of conditions that you're seeing patients here, and how it compares to your experience at the other teaching clinics?
So far I've had 53 patient contacts here, and I would say between 5 and 10 of them have been pediatric.
Mm.
I would say that I've only had 1 or 2 patients over 65, which I think is an anomaly. My colleagues have been seeing a significant amount more. I'm seeing a lot of patients that are between 30 and 55 years old, and the majority of the people that I'm seeing are coming in with either desire to lose weight because they've been instructed to do so to manage their metabolic syndrome or their dysglycemia or hypertriglyceridemia, or related to fatigue. I've had patients come in complaining of fatigue a few times, and my first treatment aim with a lot of people is to look at their nutrition, and I've seen some really good effects, especially in patients with fatigue 3 or 4 times now, just some simple nutritional changes that have really had a profound difference in how they're behaving day in and day out, and how they feel day in and day out.
In terms of, we've heard that the conditions seen here are similar in some ways than the RSNC teaching clinic. But the stage in which you're seeing them is a bit different. Is that something you've seen? Is it like, are the things you're seeing here just the kind of things you've been seeing at RSNC? Was there anything that differentiates what you're seeing?
So I would say that for the most part it is the same. The cultural aspects are a little bit different, so I'm seeing a lot more East Indian population here than I am at the RSNC, which poses differences in treatment as well. I'm having to take into account different moral and religious ideas when it comes to nutrition and lifestyle. Mm-hmm. It certainly has been an aspect that it's pushed me to learn about different cultures, which I've enjoyed. Other than that, though, I think the patient experience has been pretty similar overall. Okay. I'm still seeing people who are co-managed with other practitioners, for the most part MDs, and so it's always largely their first experience with naturopathic medicine that I'm seeing here, and they usually have a GP and another specialist that has already given them a preliminary diagnosis, and so we're working with either co-managing symptoms from their medication or their decisions to go off their medication, or managing other concerns they have on top of current diagnoses.
Okay. Impact. Tell me about what do you see as the impact of this clinic on the health of patients here in the community?
I mean, I can speak of the patients that I've seen. I think twice now I've seen the daughter of a parental couple, and since then both parents have come in to see me. And to me, that's the kind of really strong impact on a family and on an entire family culture that makes me proud of what I'm doing. It's not just a matter of helping one patient and only helping that one patient. I think since this is a community clinic and it is accessible because it's very obviously no cost right now, there's very few barriers to someone making the changes in their own health when it is so accessible, so close, and they get to know you so well because they're seeing you through the treatment of their child. So I've actually really enjoyed working with both of those families on all accounts, because I've really been able to see that they're passionate and they want to make the changes, and I think because of decreased barriers they've been able to come in.